Hi guys, my name is Hong Kai. I am the Clinic Director and Chief Physiotherapist over at Benchmark Physio. In today's episode, we delve into lower back pain and more specifically how we would triage a lower back pain patient that presents in the clinic. I hope you find the presentation helpful. Do remember to follow us on our socials on Facebook and Instagram. So, a patient presents in the clinic with acute lower back pain. Immediately, what we try to do is to work out whether the patients might have a serious spinal pathology, nerve root pain, or non-specific lower back pain. And if you look at the statistics, the chance of them having serious spinal pathology, it's 1 to 2% of all the patients that present in the clinic. Nerve root pain would be about 5 to 10% of the patients. The bulk of patients that present in the clinic, 90% of them usually present with non-specific lower back pain. So that would be pain in the lower back or sacrum area that may radiate into the buttock or thigh but not below the knee crease. And usually they fall between the ages of 20 to 55, and the pain is mechanical in nature, meaning that it depends on activity. For example, sitting for a long time creates pain, walking for a long time creates pain, standing for a long time creates pain. If you fulfill all these criteria, it is very likely that you have non-specific lower back pain. And patients that fall into this category usually respond to physiotherapy and medications as a first-line management option. Moving on to serious spinal pathology, this is actually quite rare in most of the patients. I've given two examples here. So one is cancer. Usually we'll ask a series of questions to determine if the patient might be suffering from cancer. So if they are older than 50 years old, if they have a history of cancer or unexplained weight loss, then that might increase our suspicion that the patient might be having serious spinal pathology. Likewise for vertebral fractures, patients older than 50 years old who are female and who has had some recent major trauma, we might suspect that they might have a more serious spinal pathology. And usually these group of patients, we need to send them off to the medical professionals, so the orthopedic surgeon, the emergency doctors to get them further assessed before, and if serious spinal pathology has been cleared, then they would then be sent on for physiotherapy management. The last group of patients that we commonly see in physiotherapy would be patients suffering from nerve root pain. So they would have the nerve root pain descriptors, so pain in the legs, pins and needles, numbness. Usually the leg pain is worse than back pain, and they would present with a positive neurological exam. These patients would usually be managed with physiotherapy unless we find that their nerve symptoms are progressing, and in that case we would send them off to the doctor to get imaging. So I hope that you found this classification system useful for your understanding of how we usually deal with lower back pain when you present in the clinic. Until next time, do remember to follow us on our socials, and we will see you again next time.